Well, welcome everyone to CTAC and CCSI's coordinated offering, Turnover a New Leaf, Employee Investment Series, How to Create a Thriving Behavioral Health Agency by Investing in Employees. As noted in the chat, please chat to the presenter and host with any comments and questions throughout the presentation today, and we will also have time for questions at the end. So let's get started. Welcome, welcome. Hopefully everyone is having as much beautiful weather as we are. To introduce ourselves today and our presenting team, my name is Mary Musa Rogers. I'm completing my PhD in clinical psychology. Today's work is some of the work I've been doing with CCSI. We also have David Morsnick, a former CFO and current Senior Director of Fiscal Practice Improvement at CCSI, and Chris Copeland, former CEO and Director of Consulting at CCSI. What today is going to look like. So as you know, this is part one of our 4 content sessions that will include information and tools you can take back to your agency. We're going to be spending some time in each session demonstrating some tools for you and providing real-world examples to facilitate your practice. We're also going to leave time at the end for question and answers to best set you up for success after each session. So just a general kind of breakdown. And what to expect. Today we're gonna, oh wait, did I flip the wrong thing here? Oh, what it will look like, right? What to expect. As I mentioned, these are the things we're going to be doing. Apparently I had a duplicate of the slides here. All right, overview of today, that's where I was going. So today we're going to focus on defining turnover in the context of behavioral health agencies. We'll talk a little about what the recent turnover rates look like, define turnover, and then demonstrate a tool for you to both calculate turnover and the cost of turnover within your own agencies. And as you likely know, later sessions will cover the causes of turnover, how to assess the causes of turnover in your agency, and solutions to turnover. Just to remind you that if in this first session leaves you wanting more, there's going to be more to come. So let's get started with a modified quote by Peter Drucker to consider. Culture eats strategy for breakfast, technology for lunch, and then ... And the reason we're starting with this quote is to help frame the lens with which we would like you to view this series with. Specifically, that it is tempting to apply any and all strategies you learn to help improve your agency. But as many of the best leaders know, strategy without cultural consideration or cultural change can be less effective and less meaningful, especially in the long term. If you want long-lasting change, you have to understand that cultural adaptation will always beat technical strategy. There's lots of reading material on organizational culture, and there's also additional CTAC materials we'll have linked to you at the end of this PowerPoint. But here's a general model for you to examine that focuses on how people interact within, like how your employees interact within your organization and how people respond to change within your organization. So take a moment to consider where your organization might fit, and if it's where you think you'd like your organization to be. If you're comfortable, chat in an answer or a response or a comment. Although we won't have time to necessarily delve deeply into organizational culture in this series, if you find you would want more material, like I said, we'll link additional. But so as you see here, and I don't know if y'all can see can you see my mouse, my cursor on here? No. Maybe. No. Okay. All right. Well, so we'll just say on that horizontal axis line, we have how people interact from independent to interdependent. And then on that vertical axis line, we have how people respond to change from flexible to more stable. So again, this is kind of an early lens for you to consider. And I know I haven't seen anybody respond yet, and that's okay. Maybe just something for you to think more about in terms of how is it that you can apply some of the things we talk about today and over the course of this series in terms of how your employees are likely to respond given your organizational fit. And just another kind of, another room for thought, another framing for you to consider in addressing turnover. Oh, and I just saw that somebody did chat in, so thank you. Someone said, I think we would like to see ourselves as purposeful and caring, but we really are working from a results authority place these days. And I appreciate you sharing that, because I think that that's kind of what I was starting to get at with this next piece, right? Would others say the same thing in terms of how maybe you want to be, or how maybe you see yourselves, and how do your employees see you, or how do even maybe some of your outside partners see you? And so similar to a therapeutic client that comes in and tells you that they've already tried any and all of the coping skills you might suggest, sometimes we think we've tried every solution to reducing turnover, and we likely have attempted many strategies in the past. However, sometimes strategy has to be adapted or fine-tuned for the context of our situation or for the cultural context of your organization. And I think some of you are probably already getting at this, but that even in this last year, how much we have seen changes in our own culture and our own climate, and how much that means that we've had to shift. So hopefully, as we discuss these strategies over the incoming weeks, you'll consider how your organizational culture, such as how your staff interact, how they react to change, may impact the types of interventions you apply. And so here we have a healthcare framework or model for you to examine. Many of you have heard of the triple aim and improving client outcomes. The triple aim was developed by the Institute for Healthcare Improvement as a framework that describes an approach to optimizing health system performance. Agencies should pursue to deliver excellent quality of care at optimized costs while improving the health of their population. However, researchers suggest that in order to accomplish the goals of the triple aim, a fourth aim must be pursued, which is improving employee experiences, this highlight of this series. Turnover is directly tied in with improved employee experiences, as we'll discuss throughout this series. And improving employee experience will not only cut the cost of turnover for organizations, but also improve your clients' experiences and outcomes. So a win-win-win-win, hopefully. So what is voluntary turnover? Generally, voluntary turnover is defined as when an employee chooses to leave a job. Although involuntary turnover is also an aspect of turnover, it is typically much smaller than voluntary turnover and typically comes with kind of its own difficulties in calculating costs. So throughout today's session in particular, we're going to focus on voluntary turnover, but later on we will address some of the issues around involuntary turnover because it can be related to aspects of voluntary turnover, such as poor supervision or poor onboarding. To operationalize how voluntary turnover is calculated, typically we calculate the total number of voluntary turnover or resignations across 12 months and divide that by the total number of positions in the organization's workforce. So how much turnover is occurring in behavioral health? General estimates of voluntary turnover in behavioral health across New York State was approximately 34% over 2019, whereas the national annual turnover rate was about 27% in behavioral health. These numbers can help you assess where your own organization fits among national and New York State averages, and to further compare the overall turnover rate, meaning all types of workforces, not just healthcare or behavioral health, is at around 15 or 16% in the United States. But also we know that these numbers vary by the type of behavioral health care facility. So here we see national outpatient turnover is about 25%, national inpatient hospital turnover around 28%, national substance use drug rehabilitation turnover at 33%, and then we have this quite large number of national congregate care turnover at about 128%. So, and these numbers have ranged in years in terms of where typically between 2018 and 2020. So there's also some differences to consider in terms of the year that this was assessed. But overall, you can see quickly how the different types of facilities that you work in and the different type of facilities that you are working for means that your strategy has to be fine-tuned for the context. So it's also important to emphasize, right, that these facilities have different needs and thus have different cultural contexts and different strategies you'll have to apply. And furthermore, this is not going to be the same across individuals within your agencies. So as you can see here, some demographics have lower retention rates than others, right? So you'll see that employees, like most challenged with retaining employees under 30, maybe employees in specific program administrative areas, entry-level staff. But it's key to understand why employees might be having difficulties with retention. Employees under 30 are more likely to leave when there are Employees under 30 are more likely to leave when there are few career development opportunities. Entry-level staff are more likely to turn over when supervisor relationships are stressful, and people who are members of oppressed groups are more likely to leave when policies around equity and inclusion are poorly defined or structured. And I just saw a question in here, total number in the workforce. Will you address when to calculate the total? For instance, what if the nature of the organization changes so that more or less staff is required? Yes, that we will absolutely discuss aspects around when it is best to measure, and that will be focused around the tool that we talk about today. But that's a great question. And I think that, again, this year has done a lot for us in terms of when we're supposed to be measuring these things, because major events have occurred over the last months, and sometimes changes happen more quickly. Actually, hold on before I go there. So thank you for that question. Other similar research suggests that supervisors' turnover rates in behavioral health agencies are estimated at around 17% in comparison with the approximately 35% rates of non-supervisory staff. So this is also just a reminder, right, that there's differences in employee demographics that are going to facilitate your understanding of who's more likely to turn over and maybe who you want to be assessing in turnover. But then there's also, it's important to remember that not all the time are the people who are making decisions about turnover are always impacted by turnover as much. So, as I think we're kind of getting at, most of this data was from prior to 2020, and obviously 2020 didn't occur from a January to December year timeline. So, what do we think the pandemic has meant for turnover and recruitment? Have you shifted your practices? What could be useful to maintain? Or maybe what are some of the consequences we may not have seen yet? And I'm just going to give y'all a second to text in your or chat in your answers. And while y'all are chatting in, I'm just going to go ahead and provide an example so CCSI has worked a great deal with some of the agencies who have experienced, a lot of change and fluctuation over the last year, as many of us have. And so some of the agencies we've worked with have discussed difficulty in recruiting new workers throughout the pandemic, large increase in burnout and among staff that leads to both turnover, but also decreased work effectiveness. And this also reminds us that aspects of work, such as trauma-informed responsiveness and supervisors may be key in working with post-pandemic healthcare workers. Other agencies discuss things like moving to telehealth, increased quality of life even for staff, especially for those who are caregivers, and that maintaining that flexibility is important to caregiver workers retention. Okay, so I'm seeing some people chat in. Thank y'all. Let's see. I see more turnover as people left to stay home with kids. So quite a few indicating that there's more people leaving to stay. High turnover at the beginning and then slowly decreasing over time. So maybe some people really leaving quite early on and then maybe less so over the next couple of months. Higher turnover, more jobs available, competitive wages, have to give COLAs to staff and relooked at providing new benefits, right? So more competitive atmosphere, and I think that's something that comes up a lot more in states like New York State, where there's just so much more healthcare and behavioral health organizations than there are in other states. So I definitely think that's, again, one of those unique cultural context pieces to consider. Certainly recruitment is skewed to reflect at-home requirements, such as internet connectivity, utilizing more work from home models. Unemployment payments have been paying more than what some hourly positions have been paying, so people are fine receiving unemployment, yes. Children are homeschooled, so people are unable to work or not willing to work. High turnover in both outpatient and congregate care and substance use. Double in resignations this last year. Thank y'all so much. This is great for sharing all your experiences. So I think that we're seeing a lot of the similar kinds of things. Turnover feels high in general, and it seems like quite a few people have even left the profession entirely to be stay-at-home caregivers. Yeah, the opportunity to work at home has been very appealing to staff. No staff are applying to replace vacancies. Fewer applicants during the pandemic. So potentially caregiving might be a gender thing too, which is important to consider. Who is more likely to be the caregiver at home? Yes, wow, excellent. Thank you all so much for sharing all of these. Let's see. Yeah, after seeing many people leave, oh, that jumped down. More private practice openings, offering more competitive wages we can't compete with. Yeah, that's a good point too. So the differences between nonprofit behavioral healthcare agencies versus those that can pay more. And then thank you so much for this last comment too. We think people may be leaving because of the lack of human contact and employee peer support within the agency. I think that's a really good point too. So these are all really, really excellent comments, and thank y'all so much for sharing these, because I think it ties in really well with some of the pieces that we're going to talk about over the next couple of weeks, but also just trying to think about what are the things that we have shifted and what are the potential mentality shifting pieces that we're going to have to consider when we try to reduce turnover or increase retention even in the future. So some early data. So, we don't, of course, 2020 just happened and we're still experiencing, the pandemic in many ways. So this is early data, but research is generally suggesting there was approximately a 2.5% voluntary turnover rate per month. So similar to that calculation from before, they're looking at how many vacancies are occurring basically per month for that workforce of those agencies on average. And this is across all types of behavioral healthcare, right? So of course, some of y'all mentioned again that by facility piece, and I think that's an important piece to consider. 11% of healthcare workers left their jobs in 2020 in general, and 14% contemplated leaving the profession entirely. So almost not quite 1 in 6. So similarly, out of all the vacant healthcare positions at agencies, and again, y'all have already noted this, only 13% were filled throughout the pandemic. So we're also seeing high understaffing rates. And we're going to discuss this more in next sessions, but understaffing obviously leads to stress, leads to burnout, leads to increased voluntary turnover. And some of the data that this was pulled from was from organizations that do track turnover. So, out of the organizations that they even reached out to, only 68% stated that they tracked turnover, and only 19% of organizations reported having a formal retention strategy. So something else to consider in terms of kind of where your practices are at. So how much does turnover cost your organization? So the exact cost of employee turnover ranges from 33% to 200% of a worker's annual salary. Some of the direct costs may be really obvious, right? So this includes costs of previous employees' departure, their exit interview, paying out unused vacation time, the cost of recruiting new employees, the cost of interviewing them, and the cost of onboarding them, right? How much time and how much HR support and also just other staff support is needed to get your workers transitioned. And then some of the indirect costs may be less obvious. So this can be things like the amount of time a new hire takes to adjust to their new work environment. How many cases are transferred to the new clinician versus how many were closed out, and how long it takes them to build up to a full billable caseload. Similarly, aspects such as skill differentials between old employees or new employees. I know one of the examples from an agency that we've worked with in the past had an employee that left who was bilingual, and the new employee that had joined was not. So that skill differential was immediately noticed in terms of what clients could be picked up more easily on their caseload. And even with things like translation services, we all know that some clients are just more comfortable without the translation service as the third human in the room. And then there's other aspects that are more complicated, such as team morale, right? So, sometimes there's these interpersonal differences between the staff who left and the staff who join. And so, your employees trying to kind of navigate how to develop those new relationships, learn to trust that new individual, but also maybe even grieve sometimes losing that other team member, because maybe that person was integral, not just in a skill-based way, but also in some of what we refer to as those soft skills, right? Those conflict management skills. And maybe that person was just a bright spot in terms of interpersonal and that peer support piece. So now I'm going to turn over, sorry for the bad joke, to David to introduce the turnover calculator tool. And so this is an Excel-based template, and I'm going to give him sharing rights. And so once we're done demonstrating this for you, this will be available on the CTAC website for you to download. And David, I'm going to make you present.
Okay. Thank you. Let me share the model here. Oh, 1 second.
All right.
So is everybody seeing an Excel spreadsheet on their screen?
I am.
Okay, good. Well, good morning, everybody. As Mary said, my name is David Morsnick. I'm Senior Director for Fiscal Practice Improvement at CCSI. And as we were beginning to talk about this presentation, one of the things that I was a CFO for 32 years, and, I'd see numbers about what turnover costs, and, even if the numbers were for healthcare, and I always was not sure about those costs. I always felt that they get lumped in. They don't maybe take into consideration the amount of billing that we lose, the amount of PTO that we pay out. And I was curious and wanted to know really what the true costs were for my organization. Because as you know, staff have very different salaries. You have income producing staff, you have non-income producing staff. You can have non-income producing staff with lower salaries, or even executive leadership with higher salaries. And so I just never really liked the averages. So what we did is we put together a model that allows us to calculate, not exactly, but certainly at a higher level of confidence than just taking an average that you may read or about what turnover costs. And so what I'm going to do, like Mary said, this calculator is going to be available to you. We've also have a companion guide, which is basically taking what I'm going to talk about every input field, where you may get the data, how you can use these models for building different scenarios. And one of the things that I'm going to be talking about is how could you use the model to understand, first of all, what your true costs are, and then what if, and then decide that maybe we're going to invest some resources into addressing our turnover rate. Now, what the model is going to be able to do is help you calculate a little bit of return on investment. So, and you'll see as I walk through, so it costs me X, it costs our organization on average $600,000 a year in turnover. What if I invested $50,000 and reduce my turnover rate by 10%? What would the result of that be? Because many times, not understanding what our costs are, then it's hard to invest because it's extra money that you're putting in. It's hard to invest in initiatives or changes. But what we hope to be able to do with the model is help you better quantify what your costs are, sort of pick a dollar value that you think you could invest in what a reduction in your turnover might return to you. So let's talk a little bit. I'm going to walk through the model. So you'll see on the model there are yellow boxes, and those are input fields. There's blue boxes, and those are calculated fields. The model has 2 tabs. In this first tab, which is called the basic model, what we've done is we give you input fields to calculate the cost of income producing staff, because they're very different in cost structure than the turnover costs related to non-income producing staff. The other piece of the other tab basically replicates the model from the first tab, because you may go through and evaluate your turnover and evaluate your turnover by position. So you may evaluate your peer positions versus your licensed social worker positions versus, say, a nurse practitioner position. They all have very different cost structures to them. So if, say, you wanted to take a look at what your turnover costs were for 3 of your income producing positions that have very different cost structures to them, you could do that and analyze your total organizational turnover. Same thing for your non-income producing staff. But we're just going to focus on the basic structure of this calculator right now. And again, some of these numbers you may have to go to finance and ask them. You may know some of them. It is not designed to give you the exact dollar value of your turnover. It's designed to give you a reasonably good estimate. So let's start with the input. And let's take a look at our income producing staff. So let's, as an example, this would be a licensed social worker in a mental health clinic. What's the annual salary? On average, annual salary for my organization on average for that staff is $50,000. So then the next question is, what is the fringe percentage? Now, that's something your finance team should know pretty much off the top of their head. And in this case, we spend, our fringe benefit is 31% of gross. So we basically spend 30 cents on fringe benefits for every dollar that we pay in payroll. So, although we could take a look at $50,000 and divide it by our work week, in this case is 37.5, and have an hourly rate, that does not take into consideration your fringe benefits. So once you add your fringe in there, this $50,000 salary is $65,500. But that's not the end of your costs either. There's operating costs associated with each of your positions. You have, pre-COVID, we had travel costs. In COVID, you may have increased technology costs. You have your brick and mortar buildings. You have to pay for utilities to keep the lights on, supplies, like I said, equipment. So there is a cost attached with each employee that you have. Now, then we put $12,000 in here. It's a simple calculation. Finance can do that for you. You basically take your costs other than personal services and fringe and divide that by the number of staff you have, FTEs you have. That's a number that can be easily generated off the CFR. In this case, it's normally 12 to 14,000 or so. You have an A&OH expense, and that's normally around 15%. So this $50,000 a year staff, at the end of the day, really costs about $89,000. And so what's the average hourly rate? Because that's going to be the number that we're going to use here. At a 37.5 hour work week, the hourly rate is $45.71. You can change any yellow parameter and it will, or variable, and it will change the model. So what if we had a 40-hour work week? You'll see that the hourly rate went down. How about a 35-hour work week? It went up. So we really need to know what your work week is to get an accurate hourly rate. And then we're going to take this down to a daily cost. So this salary, this staff costs about $343 a day, and of paid days. So that's where we get down to our basic costs. And the next thing is we have to begin thinking about income production, because you have staff, In the income producing programs, that is the key variable, because you have to do, that program is designed to generate revenue to cover your costs. So we have to take those into consideration. So the first thing we want to know is figure out what your average daily revenue is. So this is a simple, what's the daily billable contacts on average? And in this case, it was 5. What's the average reimbursement rate per contact? It's about $100. So we're looking at probably about $500 a day in average revenue on the days that this is average for all paid days, and this is average for all contacts. So you see we have about an average daily cost for this staff of $343, an average revenue of about $500. This is not an uncommon kind of a situation. Now, if this position had 4 average daily contacts and the reimbursement rate was 89, you'll see that those numbers change. So in this case, with 4 contacts at an average reimbursement rate of 89, this position basically breaks even. But let's say it's 5 and we're reimbursed about $100 on average. So now what we have is we've calculated an average daily cost. We've calculated an average daily revenue. So what is the input parameters here for a position type is the annual salary, fringe benefits, operating costs, percentage of overhead, and that's going to generate all the variables we need. So then let's take a look at the cost per turnover. So let's think about this. Normally, everybody leaves with a number of days with PTO that has to get paid out. Now, that's not always the case, but in my experience, most people leave with some PTO that needs to be paid out. So in this case, you're paying PTO out for somebody who's not physically on site and are not providing billable services. So these are actual fixed costs. So for the rate that we have for this individual, if you pay out an average of 10 PTO days, your cost of PTO payout is $3,400 and your lost revenue is $5,000 because you're paying money to somebody who's not generating any revenue. So in this case, your payout of PTO for 10 days costs $8,400 to the organization. So let's think about a billable person and they give you 3 weeks notice or they give you 4 weeks notice and they start winding down their caseload. Because you can't see everybody up to the day before you leave. That's impossible. We start transferring cases, you stop taking new intakes, and over the last 3 weeks, we normally see a pretty significant reduction in productivity. So what is that reduction? Well, let's say it's about 50%, or it could be less. In the last 3 weeks, we could be seeing 40% productivity from somebody. And now there is an additional cost related to that because that is lost revenue. Again, you're paying somebody to maybe be physically on site that is unable to generate in revenue for you because they're beginning to wind down their caseload. So you see how this revenue piece has a really significant cost associated with it. And then you have average productivity as a percentage of replacement for their first 3 months. Will you replace the staff? I don't know about you, but our staff never. It took a little while to come up to 100% productivity. They have to build caseloads. They have to learn your EHR system. There's a whole variety. So in this case, we'll say in the first 3 months, we might get 70% of the productivity that we would have gotten for a regular full-time staff who had been here for a while. So you'll see we pay out PTO days We lose revenue for those PTO days we pay out. We lose revenue as people wind down their caseloads. And we lose revenue because we're replacing a regular full-time staff with a new staff who has to build their caseload back up. So that's why we broke it out revenue, non-producing revenue in our calculator, because the revenue generation piece has such a significant cost. So let's talk about some of the more traditional ways that we think about turnover. And here's, you have staff in your HR department, and what are they doing? They've got to post the positions, resumes come in, you have to review resumes, you do interviews, you have to do onboarding, people need to be trained, they have to sign off on policy and procedures. So basically what we said, well, who does this in your organization? Is it somebody in your HR team, and what do they cost? Because we want to be able to calculate how much of a cost goes into these more traditional costs related to bringing somebody on, onboarding them, getting resumes, doing the interviews, doing all of that. And this is just sort of an average kind of number. And it takes, and we talked with our HR folks at CCSI, and they said it's about 20 hours altogether. So you'll see that that's about $1,000. And then, so what's it cost to post a position? $400. What's it cost candidate screening? They may have to have fingerprints, that you may do a credit check on them, another $55. So here's the total cost per position of this position of $21,000. So every time this position, which is an income producing position at $50,000, turns over, it costs us $21,000 a year. What if, in fact, you find that 30 of your positions of this type turn over in a year? That cost is $654,000, not an insignificant cost. What if it was only 10 staff? There's still $218,000. And Mary had said the cost is between 35 and 100% of the cost. We're calculating the cost here as about 44 to 45% of an annual salary it costs you in each individual's turnover. So what we say, okay, we did this, we found that, we have a problem with our staff that's working in the clinic. That position is turning over. Last year we had 20 turnovers in that position. That's a $436,000 cost to your organization. So you get everybody together and you say, okay, what if we could reduce turnover for this position by 10%? And what's 10% from 20? It would be 18. I mean, so we're not talking about huge numbers here. If you could reduce the turnover in this position by 10%, you'd save $43,000. So what if you said, okay, let's take $20,000 and invest it back into seeing if we could reduce turnover by 10%. What if you could reduce that by 25%? Save $109. What if you could reduce that by 50%? You'd save $218,000. So the calculator is designed to do a couple of things. One is to better help you understand and think through some of the components that are affecting your turnover, the cost related to that, particularly for the here income producing positions, and give you an idea to set a goal. Let's set a goal of 25% reduction in turnover just in this position, and we could have $109,000 savings to our organization. Let's do it real quick. We'll go through non-income producing. And let's say this is, I don't know what staff this might be. If we did a clinical supervisor who wasn't an income producing position, let's say that is somebody who's been around for a long time, 62,000. What we have here is a daily cost of about 412, but they don't have any bills, so we're not losing any revenue. We do pay out PTO time, and so let's figure that another 4,000 in here. Still about 940 for onboarding, 400 for posting, 55 screening, and let's say we have 10 of those turnovers. So that is a lot less, about 55,000 a year for those positions. But if you added these two positions together, we're looking at a 400, almost a $500,000 cost in turnover. So, like I said, what we're doing is we're trying to help you understand a little bit more discreetly what the cost is in your organization, the difference between your cost for your income producing staff and your non-income producing staff. This model allows you to do this for a number of different positions. Like I said, the cost for an income producing staff of licensed social worker may be 52,000. A peer might be 41, but a nurse practitioner could be 140,000. And if you have 140,000 in your costs, and even if you turned over one of those costs can be pretty significant. So, Mary, I'm going to turn this back over to you, and I hope you find the model to be useful and helping you understand a bit better about your turnover rates. And let me do this, and I'll give you the ball back, and you can carry on.
All right. And just to be clear, if anyone has any questions right now, they can go ahead and ask them as far as like questions about the tool or use for the tool. But we also, in just a few slides, we're basically almost to our question and answer session. So, as David was saying, the purpose of using this tool is to help you set benchmarks and track progress in terms of, yes, it's important to know how much it's costing you, and sometimes that can feel a little that can be a little bit difficult to swallow. But the beauty of that, as David mentioned, is that there is funds in the savings portion of that. If you reduce turnover and can save some of that money, that it can be worthwhile to invest some of that money and see how much you can reduce your turnover and thus save on costs, but also invest in your employees. As far as learning a little bit more, let me see if I can share my screen really quickly. Yeah, I'm just going to show you really quickly on the TAC website. As y'all are very familiar, here is just where these links will take you. So here's more information on organizational culture, if that's something that you feel that you would like to learn more about or like additional materials for. And then here we have the PDA, which is the Performance Driven Academy on Strategic Planning. And this is if you would like more information to kind of understand the steps to take to support successful planning. This is more general, but can be applied to some of the TAC turnover piece of work that you're doing. Let me see if I can just really quickly. Are we back to seeing the PowerPoint?
Yes, you are.
Yes.
Yeah.
All right, wonderful. Okay. So yes, so just some additional reading materials if you find that those are areas that you need more assistance with in working with your agency and in using the tool that we have provided. And next steps. So today we've just shown you, right, what are the general numbers for turnover, what are the costs of turnover, and kind of how you can use this tool to help you calculate that. But then these next coming steps are probably of more interest to you in terms of what are the direct causes of turnover. Some of them y'all very blatantly discussed today, but we'll talk a little bit more about how to better evaluate some of those pieces in terms of what is beyond burnout, right? We talk about burnout all the time, but what does it actually look like? What is it practically, in a practical way, what does it look like? And also, how do we evaluate it in a meaningful way? But also, what are some of the other aspects to turnover that we may be overlooking? And then we will also then go into how to best assess turnover, both with exit interviewing and stay interviewing. There's also MTech and CTAC have resources on onboarding and employee retention you may want to familiarize yourself with as well. And then there's the solutions to turnover, which I know we saved the best for last in terms of what are some of the best steps or best practices that will help in reducing turnover. But of course, as I mentioned at the beginning, and we'll continue to mention throughout this series, there are so many different nuances to your particular organization. And so it's so important for you to evaluate, what does my organization need? How do I fine tune some of the things that they're suggesting for my organization's culture and for my employees so that I'm getting the best bang for my buck, really? And
So Mary, can I just add
Yes.
The good news in all this is that a lot of the reasons for turnover are within our control. I mean, I think back as a CEO and chief operating officer, turnover was something that I knew was bad, I knew was high, and always I ended up shrugging my shoulders and thinking, well, there's nothing really we can do about it. It is the industry standard, 33%. If we got down to 25%, I think we congratulated ourselves. But the good news about the research and what Mary's going to be presenting is that there are things that we can do about it, because salary isn't necessarily the big driver around turnover. It's about culture. It's about dissatisfaction with supervisors. It's about lack of opportunity for growth and training. These are the big things that really either drive people to leave or help people to stay if they're good. So the calculator that we've shown you gives you an idea about what may be available to invest in those sort of activities. I think if you look at the calculator and play with some of the variables that for income producing staff, one of the biggest variables about cutting the cost is about increasing revenue sooner rather than later. One of the least expensive things that the calculator shows is increasing the onboarding time. That has little effect on the cost of turnover. So there's a clue there in terms of maybe investing in onboarding, maybe a way of gaining retention and improving productivity for staff quicker. Maybe counterintuitive to what a lot of us have thought about is that, you know, onboarding takes time, it's energy, it's a waste of time. But I think that the research will show that taking time around onboarding and culture and supervisory relationships are really where the key to retention is. And so that's what Mary's going to be focusing on the next few sessions. And as I say, as a former CEO, I think it was very eye-opening to think about that turnover was in my control. And I hope you get from the rest of the sessions that the savings that you can look at on the calculator are there for you to use in terms of solving some of these issues. Back to you, Mary.
Thank you, Chris. No, yes, I appreciate that. And I think, you know, as we're saying, hopefully the hope of all of this, and I think that y'all feel the same way in terms of when you're working with your clients, right? You're hoping to empower them. And my goal with this series is really to empower y'all to feel like you can take control over some of these aspects that feel really out of our control, especially in this last year where so much has been out of our control, and hopefully take some of that control back and be able to say, okay, these are the steps that we can take to best facilitate retention in our workforce, and hopefully care for them in ways that are trauma informed, in ways that are equitable, in order to better maintain them, but also to really fulfill the values that many of us have in our mission in terms of caring for people and making sure that our clients get the best and most quality care. So yeah, so thank you so much for your time today and your attention. And if there's any questions that you have, I know, David, I was wondering if I could bring it back up a question I saw earlier in the chat really quickly in terms of
Sure.
asked when the best time is to calculate turnover, as far as if you have changes in, in how much staff is required over the course of a year. How would you best recommend to calculate turnover then, rather than, because annual would then get at maybe, a workforce that was more sizable at one point, but now is required less of?
Well, as it relates to the model just asks you the number of turnover that you had in an individual position. So if you had a clinic and you normally had 20 clinicians, how many of those clinical positions were vacant at one point in time? So the model really looks more specifically. Now, as it relates to, say, a growth in a program where your program is growing, last year you had 10 staff, you're going to open a new site, you're going to hire 5 new people, and so the 5 new people added to vacant positions might inflate or compromise your turnover calculation. So what I would do is you normally want to take a look at, you can look at turnover on a monthly basis and calculate that based upon the size of your program or your organization at that point in time. If you calculate it every monthly, it's going to smooth out that growth that's going on in your organization, and you're going to probably have a relatively accurate turnover percentage on a rolling basis, because you're going to be rolling month over month over month. It'll take into consideration your growth. So if you're not calculating so my recommendation, and what we used to do, is we calculate it on a monthly basis. I don't know if that answers the question, but that's how we would approach it and smooth out growth within our programs.
Thank you, David. I appreciate that. And if the person who originally asked that question has any other follow-up, please, and anyone else who has any questions at this point, please feel free to ask them. I'll give y'all a moment. So someone said, as far as the calculator, would you be able to add a section about living wage compared to agency actuals?
Living wages compared to agency actuals. Well, I suppose that, say, living wage would be, as you're relating living wage to your actual position, it would more likely be your non-income producing staff. So if you figured your living wage for your region or for the area that you work is, say, $15 an hour, then that's really a simple calculation. You can take your $15 an hour and you could multiply that by your 37.5 hours per week, and you could multiply that by 52, and then you would see your living wage in your region is about $30,000, and say you were paying some of your staff $28,500, and in that case, you would not be paying a living wage. So living wage is normally an hourly rate that tends to be different by region. You multiply your hourly rate times your number of hours per week times 52 years, that'll be your living wage. And then you compare that on average for that position of what your organizational annual rate is. And for the person who asked that question, if you have a follow-up or that wasn't clear, just please chat in the chat in.
So there's also a question about not a question, but a comment that we know that frontline positions are paid very low. One of the first things I did with this calculator was go to the second tab and look at the non-income producing staff, because I was thinking back to our intellectual disabilities division, where we can have a turnover up to somewhere around 50% is quite easy, and sometimes the industry standard is a lot higher than that, and the turnover and the salaries are very low, sort of minimum wage. So the calculator helped me understand what I would have to reinvest in staff in terms of the cost of the turnover, and it showed there was a fair amount of money available perhaps to reinvest in staff, because although I said earlier on that culture and supervisory relationships are very important for very low income staff, at 25% or 50% increase in salary is what people move for. So maybe this calculator could help you look at some of those very low income, low paid staff, and to calculate how much money you may be able to reinvest in their salaries.
Right. You make a great point, Chris, because one of the things we're trying to show you is that quantify the cost of turnover and what could be a relatively minor reinvestment in your staff could return a pretty significant cost savings. And you could use the tool then as you work with your finance staff or your executive leadership to say, hey, let's take a look at this. If we can reduce it, 5%, I'm going to save X amount of money. You give me half to invest back in my staff, and you can keep the other half of the savings. But the model lets you quantify that, and you have a different conversation then.
Yeah.
Awesome. Yes, and Elizabeth O'Brien, who asked the question, said that was clear. Thank you.
Okay.
So
Thank you.
Thank you all so much for your time today. We are right up at time, so I just want to say thank you again for your participation and attention today. We have our next session next Tuesday, the 4th. So we look forward to seeing you then. And if you have any questions in the meantime, feel free to reach out. Take care.
Great. Thank you.
Thank you very much.